Obviously, preparing for surgery can be a very stressful time for patients, but I think with good rapport, with good communication, we really can work together, my patients and I, to moving them through their illness and towards recovery. What I tell my patients in my practice is there is no such thing as a silly question. Every question, if it's important to the patient, is worth asking, quite clearly. As a beginning point, when speaking with your surgeon, a nice place to start is, why do I need an operation? That's really the crux of the issue, why the patient is coming to see you. Additionally, questions to ask your surgeon are, how many of these particular operations have you performed? What is the average length of stay for a patient with my condition? In other words, how long will I be in the hospital? What are the most common complications that you see with this operation? What is my expected performance status? In other words, how will I feel after the operation? Will I have a little bit of pain? Will I have a lot of pain? Will I need pain medication after my surgery? Will that be narcotic pain medication? Obviously, the more they know about their disease and their upcoming operation, the more comfortable they'll be through the whole experience. I'm very frank with my patients in the office in that I tell them up front I'm never offended or hurt or slighted by them wanting to seek a second opinion. What's really important to me, and I think is important to most surgeons, is that people get quality care and that they get care where they're comfortable. And those are the components that really drive, I think, a good experience. I always encourage people to come to the office with the people that are important in their lives. Many times patients will say, oh, I don't remember that, and their spouse will say, oh yes, don't you remember Dr. Miller told you this, this, and this, and it's a good memory cue for them. What I tell my patients is, anytime you have a question or concern is the right time to call your surgeon. Fortunately, most concerns I'm called with are, from a surgeon's standpoint, minor, in that they don't portend a complication or require a trip to the emergency room or mean that something's wrong with surgery. But if a patient in general is concerned enough to pick up the telephone, then that alone justifies a phone call and a response. So even if there's nothing physically wrong with you after an operation, if you're concerned that there is, certainly a quick phone call and a reassuring word is positive. Times, they are changing, as they say, and it used to be, I think you went to a surgeon because your primary care team referred you to that person, or you went to a surgeon based on a name association. They were affiliated with a big academic medical center, and so therefore they must be the best. Is it more important to have a maybe cantankerous or aloof or cold surgeon who's technically excellent, or a pleasant surgeon who may not be quite as cutting edge? I really leave that to an individual's choice. My hope is that we as surgeons have evolved to the point where we can be both, technically excellent and also have a less than frosty bedside manner. I think the cornerstone of having a patient be at ease with going into an operation is the communication that they establish with their surgeon and their healthcare team.